Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program we're going to learn a little bit more about managing back pain. And we're lucky enough to have with us today Catherine Hoell, who is a physical therapist at Cape Cod Hospital. And she's going to tell us how to control it, how to fix it, get rid of it, get better at it. Very good. Thanks for being here today. I appreciate it.
Thanks for having me, Jeanne.
It's such a great topic.
Good.
I was psyched when we had the lineup, so it'll be good information, I think, for all viewers.
Good.
But I always like to start with what got you interested in physical therapy? How long have you been here?
Sure. Well, my husband and I moved to Cape Cod about 15 years ago. I'm from Boston.
Oh, great.
And my interest in physical therapy goes back actually about a long time before that. It was a personal experience with my cousin who was a car accident, actually. Ooh. And I was lucky enough to be there for his rehabilitation. And I saw the PTs and the occupational therapists really kind of put my cousin back together. Wow. And it was an amazing experience. And I went back to Boston and I volunteered for a local hospital, and I just fell in love with it. I knew that's what I wanted to do.
That's great.
So I had my training in Boston, and I got my master's at Simmons College and my doctorate at Mass General Hospital.
Excellent.
And then about 15 years ago, my husband and I moved to Cape Cod, and I've been working for Cape Cod Healthcare for the last 10 years.
Excellent.
Yeah, so I now work in Chatham at the new Oppenheim Medical Building.
Oh, that's beautiful.
Yeah, so we service the Chatham area, out the Outer Cape, so we have a nice medical facility down there with occupational therapists, physical therapists. So it's a nice place to work. Well
equipped all over, really. The Cape is pretty well set up with all the Cape Cod Healthcare facilities for
That's true,
therapy,
for outpatient.
Right?
We have one in Chatham, Orleans, and Hyannis now.
Excellent.
Yeah.
Yeah. Well, today we're talking about back pain because that's such a popular topic, and I'm sure viewers know this too, that it seems if you get into any kind of healthy conversations with friends or family, there's always that little bit about, here or there. So how many, in your client base, how many people percentage-wise do you think you see that have back pain?
It's really common, Jeanne. I mean, I have almost half my caseload is full of patients, who have some kind of back pain. So, studies have shown 8 out of 10 people are going to have some back pain episode in their life. So it's really common.
Is it precipitated by a fall or an injury, or do you have both? You see both?
We see both. I mean, you see it in the Weekend Warrior, who pulls.
I've done too much.
Exactly, yeah. And so you have an acute episode, or you also have people with chronic pain, who have a diagnosis from their doctor and they've been managing it for years.
Oh, yeah. Age groups? Doesn't matter?
It depends on what kind of back pain it is, and that kind of, determines it for age group. But it can really span at any age, depending on what you do, how you hurt your back.
Yeah. So why is the prevalence so high, do you think?
I think a lot of it has to do with our sedentary lifestyle and our weekend warrior mentality. So if we're at a desk job for 40 hours and then we go out and, in Cape Cod, we want to play golf or tennis, and exactly, and we don't do the proper maintenance for our back, I think that sets us up. And as we age, if we lose that mobility, it can just, can really add to that back pain.
Aggravates it.
Yeah,
we were talking before we came live on the show was all the nature of our life is, over the computer, over the sink, women especially maybe, over the stove, everything we do is just down this direction, and how much that can play into aggravating it.
Exactly. If you don't do the proper exercises to counteract that sort of forward activities of daily living, that can cause an imbalance and cause problems with your spine.
Are there different types of back pain?
There are, and you can kind of categorize them simply into acute, subacute, and chronic. So just like we were talking about, the weekend warrior, you go out and now that the weather's getting nice, you do too much yard work, and then you come in and the next day you're sore, you can't move. Then you take a few weeks, you feel a little better, but you're still having difficulty, your limitations, your activities of daily living. And then there are the folks who have, battling chronic pain, in years kind of off and on.
So is that first one of, I did something on the weekend, that's the acute version?
Exactly.
Then subacute would be?
After a few, it's not, you're not bed bound, but you're still having some sort of limitation. And we see sometimes, that will drive people into their doctor or their physical therapist, usually because of pain, something they can't do.
Yeah.
Yeah.
And some of the myths about low back pain?
Yeah, there are a lot of myths out there. We were just talking to one of your producers, Googling, you have this disease,
Dr. Google.
Yeah, Dr. Google, and, and there's a lot of information out there. And I think it's great because people come in with the conception of this is what I have, and then we do diagnostic skills to really look at, is that really what you have? Is that really what's going on? So I think some of the common myths is, first of all, no pain, no gain.
Oh, right.
And our motto in our clinic is no pain, good. So really if you have pain, that's a signal to your body to take a look at what's going on. Don't necessarily push through the pain with exercise or activity.
Mm-hmm.
Another myth that I hear is, I've stretched my back, I hurt my back, so I'm going to stretch it out, and that should help it. And that's not always the case. For example, we were talking about the weekend warrior. If you just hurt your back, if it's inflamed, you don't want to just be stretching it. You actually want it to calm down. So you want to be, easy with your activity, but you still want to be moving.
So keeping it moving, because I've heard that from other people. I've hurt my back there, and they say that, yes, okay to lay down for a little while, but the best thing is get up and walk.
Yeah, walk or just keep moving, maybe not go crazy with activity, but don't limit your function.
Okay, so pain is a signal to cease and desist.
Yep, and stretching the back isn't always the best thing. Usually you want to, if it goes on for more than a week or two, you want that looked at.
And so when you talk about pain, and for anybody that's been in for PT or other services, you get the little scale of the smiley face, the really frowny, crying face,
to
the big fun. At what point does someone ask the question, wow, I think I need to talk to somebody?
Well, that's a really subjective question. I mean, and some people have difficulty rating their pain when they come in. They're not even, they don't even know what number to give their pain. So it really is subjective. A lot of times we'll see people for prevention. So they won't have any back pain, but they're wanting to prevent it. They want to stay active. They're getting older. So it really varies, 0 to 10, hopefully not a 10.
Hopefully not a 10. And sometimes it's, well, just sitting here, I feel fine. I'm a happy face, but if I get up and try to do something, then it aggravates it.
Exactly.
So that's a good time to go talk to someone.
Exactly.
And usually it's a referral from a physician. Do people come to you straight on their own, can they?
You can. In Massachusetts, we have what's called direct access. So you don't need a physician's prescription to come see a physical therapist. We can evaluate and diagnose, but certain insurance companies require that you see your doctor. So you need to check for insurance coverage.
Okay.
But we can see a patient without. We always will send in our clinics for Cape Cod Healthcare, we'll always send a certification plan to your doctor so that your healthcare team has an understanding of what's going on and how we're treating your back.
Oh, that's good.
Yeah.
Yeah. So they come to you. How do you diagnose? What steps do you run them through?
So we're lucky enough in Cape Cod Healthcare in all of our offices, we can provide an hour evaluation, really sit down with the patient, get a good thorough history of what caused their back pain or why they're here. And then we do a battery of tests looking at objective information from range of motion to strength. We look at, try and diagnose what nerve or muscle tissue is involved in the back pain that you might be having. And then from there, we look at your function and then putting together a treatment plan for you.
Okay.
Yeah.
Is it low back is what you see mostly? When people talk about back pain, is low the most popular?
Low is the most popular in terms of just how we're designed walking on two legs.
Okay.
But we do see a lot of neck pain and sometimes mid-back, and it's all connected. The spine is our lifeline, so when you might have pain in one particular area, but we're really treating the whole person when you come in for that kind of thing.
Does it radiate? So it may be something funny happening down here even though I'm feeling it up here?
Exactly. Low back pain usually travels down. It rarely travels up. So people will complain of pain down the leg, typical sciatica. So you can get pain in different areas, not just in the back.
So not necessarily caused, or say the sciatica, even though you feel it in the back of your legs, it's really starting with the low back.
Exactly, and that's what's confusing, and that's why it's really important to get a good evaluation so you can figure out what's causing it as best you can, and that really dictates your treatment because it can be different for everybody.
So if we talk about exercises to help, or what muscles should we try to strengthen to help support our back, to make our back stronger?
Right.
Are there certain moves or muscles that are more critical than others?
Absolutely. When you're looking at the back, certainly the core is a very popular.
So
the core is actually it's an area of your back. I mean, in terms of what is the core, a lot of people hear about it. They go to their personal trainer, they go to the therapist. I want to strengthen my core. Exactly. And so the core basically is the area below your neck and above your legs. It's actually the center of your body. So it's not just one muscle.
It's not just the abs. I know some people think the core is just right here.
It's not just the six-pack, you know. You have the rectus abdominis, that's sort of the abdominal muscle that sits on top. Then you have your oblique muscles, which are the sides. And then underneath that kind of holds your guts in, is the transverse abdominis. So all of those muscles actually make up your core, including your back muscles and your gluteals. Those are all part of the core. And actually, a lot of people don't know the diaphragm is actually part of the core as well. So sometimes I'll get people who come in and they're in chronic pain, and we might look at their breathing pattern, because without your breath, things can escalate in pain, and it can really throw your system off. So sometimes it can come down to breathing.
Wow, fascinating. So how do you identify, or do you identify certain muscles, or when you work with people, say, we're going to strengthen all of your core, even though, for example, something like breathing?
Right. Well, it's really difficult to isolate a muscle. We don't do that in physical therapy. We really look at movement patterns, what we call synergy patterns. We might look at it as body mechanics. You know, are you using good body mechanics, lifting properly?
So you send people, you tell them to go do something, and you watch them, and
we'll evaluate.
Yeah,
we do a movement assessment. That's really important in an evaluation. Look at how you're moving, how your muscles, working to make you an efficient person. And that efficiency helps to prevent strains and pain and muscle spasms. So when we look at strengthening the muscles, the core is a part of it, but we also look at strengthening the legs, because everyone knows lift with your legs, not your back. But it's surprising how many patients I see when I evaluate them, they actually do it right. They usually end up using their back because they don't have the leg strength. And another common myth is that people think, well, I walk. Everyone in Cape Cod walks, and that's great, but that actually is not enough to prevent back pain or to really keep you healthy. You really need to supplement that with good exercise, such as squats or lunges, no matter what age. And a good physical therapist can evaluate your body and tell you what you're not doing right and give you a plan to improve that.
So the strength that walking builds is not quite enough to support
a healthy spine.
A healthy spine.
Right.
All right. Are there other recommended exercise, like you said, squats or lunges? Are there other things that you recommend for core strengthening? There are a million
exercises out there. It really depends. Physical therapists are trained to give you the exercises that are going to put the least amount of pressure on your spine. So if you're healthy and you have a good personal trainer, they might be able to give you a good program to keep your spine healthy. But if, going back to that pain, if you're having pain, you might want to have it evaluated, and then we can look, are there flexibility issues, are there stability issues, and we try to create sort of a functional program, not just crunches or something.
Right. Is stretching a big part of that?
Stretching is a big part of it, but misconception is people think, I have tight hamstrings. Those are the muscles in the back of your legs. And everybody wants to stretch their hamstrings, and a lot of times it's tight. But what's interesting, when we evaluate people in the clinic, sometimes we find that it's not an abnormal muscle in your hamstring, that you just were born with incredibly short hamstrings. A lot of times that's the only muscle that's strong, and you actually get an increase in tone. So a lot of people confuse flexibility with tone. And the reason why you have tone in your hamstrings is usually, not always, because your core is weak. So if one part is weak, the other muscles have to take over. Exactly, to compensate. And that's where it's fun. It's helpful to evaluate and really find out what muscles aren't working and what needs to be strengthened, and that really helps to promote and develop a good plan for that person.
Right.
Yeah.
Ah, so
Yeah.
very individual.
Very customized.
So, you know, because I know the viewers and me are sitting here going, okay, give me some good exercises I can do.
Right. I mean, generally you can start with doing squats and lunges, but form follows function. So if you're not doing those correctly, you can actually end up hurting your back.
Yourself,
You know,
yeah.
and that's where you have to be very careful, and an experienced healthcare professional who's trained in that
Yeah.
can be invaluable.
Right.
Yeah.
So do you send people home, say, with an exercise sheet of this is your homework?
Yes.
And if people are good, these things really work.
Absolutely, and
Yes.
that's, you know, we try to set them up on a mission, you know, their mission if they choose to accept it,
Yes.
because, you know, they have to want to do these exercises. And if I do my job right, I show them how to do them, why it's important, how it's going to help them, and then hopefully they can, you know,
Yeah.
go on their way, and whether they do it at home or a gym, that they can continue to strengthen and get better that way.
Yeah. So say someone comes in, you have them for a 6-week period maybe. Can you tell their compliance level without?
Yes, we know when you're cheating.
So that, I think that's a good
Most
message.
therapists
Yes.
know when you're not doing the exercises, but I think the key, you know, my job is to really make it worth it.
Believers.
Yeah, and give you the reason why. You know, we all brush our teeth. You know, why?
Yeah.
Well, we know why. And I think when people, you know, if they say I'm not a good exerciser, I'm not a good patient, I mean, I really haven't met a person who doesn't want to get better, who doesn't want to have, you know, not have pain.
That's why they're there in the first place.
Exactly,
right?
and their goals are our goals. And so we really try to help them develop a healthy program, whether it's in 3 visits or in 6 weeks, you know, whatever they need to help their pain and their back care.
Right. Do you feel like you have a percentage success rate?
Personally, I think we have good scores
Yes.
in our feedback. But I think everyone is a success, and not everyone is a physical therapy candidate. So, you know,
right.
if it doesn't work, it's important to assess that, and then to refer them to the right
Something
healthcare
else.
professional. Yeah,
Yeah.
if something, you know, isn't working, if they plateau, if they're not improving, then that's really important to re-look and say what's going on, what did we miss?
Yeah.
Yeah.
So assignments that people take home, say my 6 weeks is up, these could continue even past that point. I mean, 6 weeks is sort of a funny time.
Exactly. I mean, you know, some people ask me, how long should I do these exercises? And I usually respond by saying, as long as you want to feel better.
Yeah.
You know, we're
So it becomes a
movement.
lifestyle change.
It's
almost.
exactly
Is that
right.
So it's good. I think that's just good for people to know that now that you check those appointments off the calendar doesn't mean your work is done.
Exactly.
Yeah.
Yeah.
Now, heat or ice, that's always kind of an interesting discussion with people for pain.
Exactly. So, you know, they're in low back pain. Both heat and ice play a good role, play an
Okay.
important role for back care. So if you just hurt your back, usually you want to be icing. Okay, and you know, a lot of times people will say 24 to 36 hours, but I also see people with chronic back pain that could benefit from ice. Think about it, when you wake up in the morning and you go out and let's say you're in a, you know, doing heavy lifting, or you play golf, or you're actually restraining your back, so that actually becomes a sort of a fresh or acute injury.
Okay.
So at the end of the day, ice can be helpful. So to put it simply, if you're just stiff, your muscles are stiff, and you want to warm up, think of a warm-up, then you want to put heat on it.
Okay.
Moist heat. If you have any kind of inflammation, your back feels hot, then you want to be looking at cold. You want to be looking at ice. And it's important, more isn't better with either one of them. So after about 20 minutes, whether it's heat or ice, you want to stop and reassess. You don't want to lay on the hot pack.
You've done all you can do.
Right, it actually can cause damage. The vessels can actually switch and dilate or constrict if you put either one on for too long.
Okay.
Yeah.
All right. A herniated disc, does a MRI prove that, show that? And does it automatically mean surgery?
Yeah, I mean, you know, diagnostic imaging, an MRI does show a herniated disc, but again, that's one picture, and you know, it doesn't always mean surgery.
Okay.
You know, if they look.
I just heard a sigh of relief from a lot of people that are watching this show.
Absolutely. No, I mean, you know, I think that with a herniated disc, that you look at some studies and you have people, about 50% of people have the herniated discs but don't even have major complaints in their back.
Oh, okay.
Yeah, so it doesn't always correlate, and some people don't have anything wrong with them on the MRI, or very little, and they have excruciating back pain. So it doesn't always correlate.
Okay.
Yeah.
How about lumbar stenosis?
That's a popular diagnosis
Is it?
that we see here. It's for generally people over 50,
Okay.
a little older population. It's not a sudden onset, so lumbar stenosis, you'll get that gradually.
Is that this or how?
No, that's no. The lumbar stenosis is actually narrowing of the spinal canal. It's so it actually can constrict the nerves
Okay.
and the spinal cord. So usually you'll have pain with extension. So yeah, flexion will feel better to you.
Okay.
Usually you might have pain with sitting or especially walking or walking downhill. Those are the symptoms that you might see, limited back pain. And sometimes you'll even feel pain down the legs with that diagnosis.
Oh, wow. And then what do we do about that? Is that
Yeah.
something that you call yours forever now and you just manage it?
Well, that is a good point. It's managing it, really.
Okay.
Once you get a diagnosis, degeneration, when people see that, it can be a scary term. It doesn't mean that you're going to crumble, and you can improve your symptoms if you work at it. So it's important, again, to get a good evaluation by a physical therapist if you've been referred for physical therapy by your doctor, and we can help manage it. And again, finding out where that imbalance is in your back can really help with your pain, flexibility, strengthening the core to really support your spine and prevent it from getting any worse.
So it's a management thing again. Is
Absolutely.
spinal stenosis the same thing? Spinal, lumbar, that's the same?
Yep,
sort of-
yep, spinal stenosis.
exchange.
It's more typical in the lumbar, low back region, so it's the same.
So when does someone consider surgery? Is that when you've done all you can do and there's still pain, or they go back to their physician and that's a decision made together?
Exactly. It really should be made after all conservative measures have been exhausted. Just because you see something bad on an MRI or have pain for a long time, it doesn't always mean surgery. And most of the doctors I work with will agree. You always want to exhaust your conservative measures, whether it's physical therapy, lifestyle change, management, before you consider that.
So it's good, I think, for viewers to know that physical therapy can be very successful.
Absolutely.
And you can manage your own pain over time and strengthen your own core by due diligence and
Exactly.
compliance, that things will get better. They can get better.
That's right.
Yeah, because we hear so surgery sometimes is a faster option because people are looking for a quick solution. But if they're willing to put the time in, there are other choices.
Exactly.
All right. Is massage part of physical therapy? Massage therapy, physical therapy, are they?
They're actually different. Physical therapy, we do manual therapy, and sometimes that involves soft tissue mobilization. So massage therapy is a great complement to physical therapy. Physical therapists, you want to think of us as movement specialists.
Okay.
So we're here to fix a movement problem. Sometimes that involves, if you have a spasm, it involves manipulating the soft tissue or joints to help reduce your pain or improve your mobility, but it's always in the goal of increasing a function.
Okay. A challenge.
Yeah.
So they don't need to see a doctor before they come to you.
Not necessarily.
Not
no.
necessarily,
Yeah.
so they can but if you find you've done everything you can do and maybe there's some other options, not necessarily surgical, then you'd refer them back to their physician.
Absolutely, it's important, and with all of our therapists at Cape Cod Healthcare, we always keep that communication with every healthcare provider, whether it's an acupuncturist, chiropractor, massage therapist, primary physician, orthopedic doctor, that they know what's going on, they know what we're doing, so that the patient gets the best care.
Everybody's communicating.
That's important.
That's excellent. Now, just because low back pain is so popular and we're down to our last few minutes, so what is the best way to prevent low back pain?
I think the best way, Jeanne, is no magic pill. I think a good, healthy lifestyle where you're doing regular exercise, walking, so some sort of cardiovascular exercise with some good exercises to complement for leg strengthening, a good healthy diet, low stress, are all the best ways to help prevent back pain.
So some of the exercises I know you talked about like the lunges and the squats. Are there other sort of key favorites for low back pain?
Yeah, really, when you're looking for exercise prevention, injury prevention, that would be nice if you could get exercise prevention. No,
That all came together.
For injury prevention, you really want to be looking at posture. So upper back strengthening. You want to be strengthening that, strengthening the core, which we talked about. The gluteal muscles are really important with lifting and walking. And then your legs for squats, lunges, and then following that up with a good overall flexibility program to stretch out the chest, the back, and the legs to keep everything limber so that you can move and keep your activity stress-free.
Some of the yoga classes that are out there, that's a good stretchy
Yoga
activity.
can be very effective, yes,
Yeah.
because they work on posture, stability, as well as flexibility,
Yeah.
breathing, and relaxation. Those are all important aspects for good
Yeah.
back care.
Well, thank you for your time. We are like about out of time. Do you think we covered everything? Is there anything quick that we didn't touch on that you want people to know?
I think we've really touched on it. I just want people to know that they need to keep a healthy back by doing that. Keeping exercise a priority is important.
Keep moving. Keep
moving.
moving and you'll keep moving.
Exactly.
Great. Thanks, Catherine. I appreciate your expertise and your time. That was great.
Thanks
Great
for having me.
information. Yeah, you're welcome. And I'm Jeanne Sarnosky wishing you good health and good health care.